You've heard the saying, jack of all trades, master of none, but interestingly, the original quote goes, jack of all trades, master of one. That I don't know exactly who said it. I think it was Benjamin Franklin. But anyways, so GP is kind of a jack of all trades in that sense. And when I started medicine, it was exactly that. We rotated through different disciplines. As interns, we were surgeons, then we were obstetricians, gynaes, then the next 4 months we were trauma doctors, then we were anaesthetists, then we were pediatricians, and so we got exposure to all the different disciplines. After my internship of 2 years, then I did community service in Cape Town, and I spent 6 months in the Red Cross Children's Hospital doing pediatrics. Then I spent 6 months in Mowbray Maternity Hospital doing obstetrics. Then I was an emergency room doctor for a year. Then I went to the kidney unit at Livingston for a year. I was then in the HIV TB unit for a year. And then I went into GP work. So by the time I went into GP work, I'd had a good exposure to all the different disciplines. But when I started GP work, it felt like I was doing something new. So even though I'd experienced all the different specialities, we did some primary care as interns, but it was minimal. And so I discovered that being a family doctor is a whole different discipline. A colleague of mine said recently on one of our doctor groups, he said the only thing you know you're going to get is a patient. So you can get anything as a GP, and so it is a real skill to be able to be a generalist. And but I've always wanted to be a generalist. Even when I was studying, that I knew that I didn't want to specialize. I wanted to be a generalist, and so it is something which I desired. I know some may end up being a generalist because they don't want to specialize, so kind of by default. But for me, I aim for it. So yeah, I think in terms of my trade, my skill, it took me a few years of being a GP to get to a place where I felt competent, I felt skilled. So yeah, don't know about the first few years. I mean, I guess I was practicing, but I worked out roughly how many hours I've practiced family medicine or been a GP, and it exceeds 10,000 hours. And I heard once that if you want to be a concert pianist, then you need to practice for 10,000 hours. So a master of a trade, to be a master of a trade takes 10,000 hours. So it's really enjoyable to do something with that feels like the skill of your right hand.